Good afternoon, everyone. I want to welcome everyone to today's virtual program with Turnstile Tours. My name is Andrew Gustafson, so I'll be your host today, and we are really lucky to have a very special guest today, Sara Carr, who's going to be joining us to talk to us about the work of Frederick Law Olmsted and the connections to public health. We're going to give people a few more minutes to log on because we're expecting a great crowd today. But while we do that, we just wanted to go over a couple of housekeeping items and how today's program is going to work. If you're joining us for the first time, welcome. If you're a longtime visitor, welcome back. How we're going to communicate today is through the chat. So if you have any questions, you can drop them in there and we'll try and sprinkle them throughout the conversation. If you want to share with us where you're joining us from, or if you have any connection to Prospect Park or any other Olmsted Park, feel free to drop that in as well. So we'll be communicating through the chat and we'll try and get to as many of the questions as we can. Again, we're expecting a big crowd today, so we'll do our very best. Behind the scenes, we have a couple people helping us. So Doug, you may see him in the chat already. He's producing today, so he's going to be helping answer any of the questions and share relevant information and links throughout the program. So keep your eyes on that. We also have Cindy, who is doing the closed captioning. So if you would like to turn on the closed captioning, you can do that at the bottom of the screen if you're on a computer. If you are joining us from a phone or a tablet, you just have to exit out of this session, go to the settings and turn the captions on or off, and then log back into this Zoom session. And so, yeah, I just wanted to share with you a little bit about us and what we do, again, if you're joining us for the first time, and tell you about some of the programs that we have coming up. So our organization, Turnstile Tours, we work in partnership with nonprofit and community organizations to really help them build capacity to welcome the public. And so we work with the Brooklyn Navy Yard, the Brooklyn Army Terminal, we work with New York City's public markets, and we also have the pleasure of working with our great partners at the Prospect Park Alliance. So in a normal year, we would be giving tours out in the park about its history and the contemporary story of the park, but we have not been able to do that since early March. And so what we decided to do was move our programming online. And so now we've done well over 100 virtual programs with all sorts of different partners on all sorts of different topics. And so we wouldn't be able to do that without your support. So we just want to thank everybody for joining us. And I wanted to share a little bit with you about some of the things that we have coming up. Let me pull up my screen here and I'll share with you our upcoming calendar real quick. So our next program is going to be on Thursday. We're going to be discussing shipbuilding in the US Navy. This is a topic obviously relevant to our work at the Brooklyn Navy Yard, but also if you've been following the news the last couple of days, we had a major accident out in San Diego that we're going to talk about as well, the fire aboard the USS Bonhomme Richard, and talk about sort of the landscape of shipbuilding today. On July 21st, we're having Noah Diamond come on, and he's going to talk about the history and the story of the Marx Brothers in New York City. Then on the 23rd, we have a couple special things happening. We are having a Turnstile members happy hour. So I'll talk about membership in just a second. So that's going to be a fun get together again in the virtual space with our members. But that's going to be followed by a special program we're doing with the Street Vendor Project. It's going to be a virtual fundraiser. We're going to be talking about the history of street vending, but it's going to be a virtual fundraiser for that organization, which has done so much to support the street vendors in New York City, many of whom don't have access to a lot of the different business support programs that have been rolled out during the pandemic. And many of them have been providing vital services to serve and feed their communities despite the economic hardship that they're going through. So that'll be a really great program. The next day, we're going to come back to talking about Prospect Park, and we're going to do a little virtual tour of the Guastavino tiles in the park. Prospect Park is one of the highest concentrations of Guastavino tiles anywhere in New York City. And if you don't know what those are, we'll talk about that as well. Then on July 30th, we're going to do a special free program with our friends at the South Street Seaport to talk about their ships. And then on the 1st, we're going to celebrate Herman Melville's birthday by talking about his brother, Thomas Melville, and his connections to Sailor's Snug Harbor in Staten Island. So those are just a few of the programs we have coming up. Other things just to stay tuned to, we have some programming we're going to be doing because July is Disability Pride Month. So we're going to talk to some service providers and some other people working in the disability space, as well as a whole host of other things at the Navy Yard, at the Army Terminal, and with our other partners. So if you want to stay connected, you can become a member. So all of this work that we do is really supported by you, by our viewers, through our membership program. And so we'll share links if you want to learn more about it. But we have different monthly subscriptions, and this gives you access to the free and paid programs, as well as our library of over 100 recorded programs that we've done. I don't want to take too much time to this, but I just wanted to just mention this and give a big thank you to all the people who are joining us who are already members. So thank you so much. It's really made it possible for us over the last 3+ months to stay in business, to retain a really wonderful staff, and continue to tell the stories of our great partners and sites and museums and small businesses that really make New York City a wonderful place. So without further ado, I want to welcome on our guest today, Sara Carr. Hi, Sara, how are you?
Good. How are you doing, Andrew?
Good. Thanks. Thank you so much for joining us today. So first things first, where are you joining us from?
So I'm just a little bit south of Boston, so south of another one of Frederick Law Olmsted's masterpieces in the Emerald Necklace and the Back Bay Fens, which I'll be talking a little bit about today.
Yeah, wonderful. And so you're at Northeastern University. Can you tell us a little bit about what you teach and what your work is about?
Sure. So I teach in the architecture department, and I have a specialization in the built environment and public health. And so in that, a lot of my teaching and research centers around just how the built environment shapes health outcomes, from where we walk, what's the quality of the places we walk, the history of the built environment and health. So talking about Frederick Law Olmsted's importance there. And of course now my research is shifting a little bit to look at not just the pandemic, but before recent events, I was really looking at how climate change was shaping our built environment and health outcomes in that way as well.
And so you've been in Boston the last couple of years. Where were you before you came to Northeastern?
So I was actually at University of Hawaii. It's just quite a different environment, but I actually had a joint appointment there in the School of Architecture and School of Public Health. But I came to Boston just because I was really drawn to the intellectual community here and how much was happening. I miss Hawaii very much, but it was far away and expensive. So yeah. in terms of a long-term plan, Boston ended up being right for our family.
Great. So we're going to dive right in. So you have a presentation you're going to share with us. And again, for our attendees, feel free to drop any questions into the chat bar, and we'll try and sprinkle them throughout the conversation today.
Okay, so I'll go ahead and share my screen. Is that coming up okay?
Looks great.
Okay, great. So thank you, Andrew, and everybody at Turnstile Tours for having me here today. Thanks for everybody tuning in and taking the time to listen to this. I'm sure that many of you that are tuning in today are probably familiar with Frederick Law Olmsted as the father of landscape architecture. But I'm really here today to talk about the context of many of his works, the physical and social conditions that guided him. But many of you may not know that he actually had quite a varied background, and these guided his designs in his most well-known parks as well. So just to give a roadmap to today's talk, I'm going to talk about what the physical context was of American cities in the late 1800s and early 1900s when Olmsted was working, how his various exploits before his career in landscape architecture influenced his work, how he envisioned his parks as biological, ecological, and social entities, and last of all, how his designs have proved relevant to today. So I think as I go through this talk, you're going to see a lot of parallels to our current crisis. But in the end, you know, and I'd love to hear from everybody listening in as well, I think we need to reckon with some of the more contradictory aspects of his philosophy's designs to really think about how we make parks a great social, health, and ecological piece of infrastructure going forward. So let's talk about the context that Olmsted was working in both New York City and Boston. At the dawn of the American Industrial Revolution, urban life was still very much tied to the rural, and so a lot of our cities were a haphazard hybrid of industrial and agricultural activity. Imagine livestock roaming the streets of stables, slaughterhouses, dairies, and tanneries would coexist with factories and even schools next door. The rapid pace of development also meant that industry was largely a self-governing enterprise with very little oversight into their labor practices and waste management. Organic, decaying matter was often emptied out into streets while the black exhaust of machinery filled the sky. These industries were often clustered at cities' edges, so they were adjacent to oceans, rivers, and lakes where they could simply dump effluent and solid waste to be carried away, what many people called a convenient solution by dilution, especially in cities with access to tidal waterways where waste could be flushed out every 6 hours. Of course, though, it wasn't long before a reckoning came in the form of disease. Cholera epidemics consumed the United States in 1832, 1849, 1866, and 1874, alongside other diseases such as typhoid, yellow fever, and diphtheria. Cholera, though, was an uncommonly violent disease. It could kill within a day and induce extreme vomiting and diarrhea. The murky waters and palpable filth of the city made the clouds of contagion visceral. Fault lines of sickness were also drawn sharply by economic class and race, and the mortality rate in poorer neighborhoods and immigrant enclaves was often almost 3 times that than in wealthier ones. So the United States often looked to Europe to see how they had controlled their own cholera epidemics, which had come a little less than a decade earlier. Specifically, they were looking to model their cities after the massive underground waste infrastructure that cities like Paris and London had installed. What's interesting, though, is it's not just the actual waste infrastructure that was installed, but many 18th and 19th century European cities prioritized circulation and movement via their street networks. And it was thought that this was also in the wake of physician William Harvey's discoveries about how the heart powered blood circulation. So in laying out the plans of Paris and London, dirt and grime were often thought to clog healthy airs throughout the city. And palaces and places of commerce often acted as hearts that powered movement, and one-way streets were employed to maintain fast movement and even mimic the directionality of veins and arteries. Many of these ideas in turn were adopted in the United States at the end of the 19th century, specifically in the City Beautiful movement, and further buoyed by the social goals of the Progressive era. Olmsted's contemporary Daniel Burnham, who was working frequently in Chicago, looked specifically to Paris in his reimagining of the city. And so if we think of the streets as circulatory systems, then parks and green space were often thought of as literal breathing organs. Burnham emphasized wide boulevards lined by trees and pockets of green in order to inject fresh air in the once crowded blocks. This was not just a design decision, though. These ideas about the physical environment were actually supported by the medical community at large. The American Medical Association had a committee on public hygiene that was founded in 1849 that specifically advocated for the creation of parks and cities. And so urban planners, doctors, and leaders in public health alike saw urban green spaces as a way to combat disease in both the air and the water. John Roush, who was a physician and president of the American Public Health Association at the time, wrote an entire book called Public Parks, Their Effects Upon the Moral, Physical, and Sanitary Condition of the Inhabitants of Large Cities in the year 1869, wherein he advocated for the cleansing power of trees and grass. And so even without the assistance of hard empirical evidence at the time, he wrote about how trees had formed protective belts against the malaria, and also told people to be cautious of winds blowing the seeds of disease over neighborhoods. Rausch even speculated on the relationship between parks and mental health, and he wrote in his book that we live in an atmosphere of excitement, more so perhaps than any other community in the world, and it is therefore more necessary that all prudent safeguards should be thrown around us to prevent the impairment of the rigor of the mind and the inroads of disease. This is an age of great mental activity, and nowhere is the mind more stimulated than in Chicago. While it is true that the judicious use of an organ increases its power and confirms its health, excessive exercise, which requires an undue share of vital energy, leads to an unhealthy condition. And so where Olmsted comes in on this movement of putting parks and more green spaces in cities for public health, he brought a specific set of expertises with him. Olmsted first saw the connections between landscape and public health during the Civil War. He was a sanitary surveyor, and so one of his primary responsibilities was site reconnaissance and planning for soldier camps. With the explicit purpose of keeping soldiers healthy, he would design the sites to keep them away from stagnant water and bad airs. And eventually Olmsted was even elevated to General Secretary of the United States Sanitary Commission. But Olmsted's experience during the Civil War also formed his ideas about social justice. Before coming to landscape architecture, he was a journalist, and even after he went into practice, he was a prodigious writer, which is why we know so much about his design intents today. In the 1850s, he was sent by the New York Times to observe slavery and the cotton economy in the South, and he ultimately argued that the cruel structures of slavery were even economically detrimental, and he did this by mapping the ratio of free men to enslaved people against cotton production. So Olmsted would eventually set up a full-time landscape architecture practice with Calvert Vaux, and at the same time was also serving as a chairman on the American Public Health Association's 1872 Committee on Sanitary Value and Uses of Shade Trees, Parks, and Forests. But Olmsted deeply understood the importance of cross-disciplinary work in both physical and scientific fields, and was even one of the founders of the American Social Science Association. And although he was very firmly an urban inhabitant, when he returned to the city, Olmsted saw pastoral landscapes as essential to health. Like his contemporary and close friend A.J. Downing, who wrote many style books and treatises idealizing rural landscapes, Olmsted also idealized country life. And we even have letters showing that he encouraged his brother to study farming instead of continuing in his career in academia. But Olmsted's real driving force was to bring pieces of rural and what he thought is morally superior rural life to urban areas. In one writing, he even expressed a desire to bring sheep back to the city. Downing and Olmsted also shared an admiration of public spaces in England, both how they were described as lungs of the city and how they witnessed the working and upper classes mixing.
I just had a question for you, Sarah,
Sure.
while we're on this topic, which is, you know, you said he talked about sort of the moral virtue of having these pastoral spaces in the city. What kind of scientific evidence were these people looking at the time, you know, to sort of justify their belief that this type of landscape was good for public health, or was there any?
It depends what you would define as scientific evidence. And what I think is interesting is, even John Rausch, who was a physician, what he was talking about was mostly anecdotal evidence. And he was talking about how he saw communities that were closer to the water were more affected by malaria. And I think what it was there was just this very intuitive, which I think we have today, that if you were to escape, what was at the time like a very dirty and congested city and could get to a park space, then yes, naturally you felt a little bit healthier. But I think and also it plays into a long-standing sort of American ideal that the city has disease, right? And the country is healthier, and that's something we see even playing out today. But I think what's fascinating is that a lot of this has been proved through empirical evidence today, right? There's still a lot of researchers out there that study the connection between landscape and public health, myself being one of them, where we can actually, calculate the amount of carbon dioxide that trees and green spaces take out. We can see how they relieve pressure on our stormwater systems. And there's really fascinating evidence that's coming out now, not mine, but some colleagues of mine, who have even put neuroscience helmets on people walking through parks and shown how just walking through a park or walking through green areas alleviate stress.
But they didn't have that in the 1850s.
No neuroscience on 1850s. So a lot of it was anecdotal, but I think it also speaks to the lasting power of his landscapes, right? And I'm sure we'll talk a little bit at the end, is that there is something very intuitive that when we walk through his landscapes, we feel healthier and we feel more at ease. And somehow we know they're good for the health of urban areas.
I just wanted to insert one more question, which we got in the chat, which is, she asks, did he say that exercise is bad because it uses energy? Was there some belief at the time that maybe being too strenuous in the outdoors might actually be detrimental to your health?
So we'll talk a little bit, I have some slides to talk a little bit specifically about what kind of recreation Olmsted thought should be going on in his parks, but the quote that I shared from John Rausch was actually about exercising the mind. And what he believed is that if the mind was under constant pressure, to watch where you were going, right? Because there was traffic in the streets and there were horses in the streets and there was, all sorts of activity, that the park could be a place for your mind to rest a little bit. So he was actually talking about the strenuous exercise of the mind, but Olmsted definitely did have very specific ideas about what kind of recreation was healthiest that would be in his parks. And I have some slides showing ideal activities.
Yeah. So we'll dive back into the story. Thank you for the question.
Thanks for the question. Great. And so even though Olmsted idealized rural life, what he was most troubled by was that the health that was perceived to be offered by nature was mainly available to the elite. So if you think about the early 1900s at this time, even though cholera and yellow fever were mostly eradicated by waste infrastructure by then, respiratory disease was still very much an issue for people living in the cities. Now, the upper class were able to go to nature resorts, such as, this, which is showing a community for tuberculosis sufferers in the White Mountains of New Hampshire. But Olmsted really believed that this sort of nature should be accessible to workers and other city dwellers as well. So Andrew just asked, a very good question about what empirical research they had, and they didn't have it, but a lot of it was anecdotal. And I think the way Olmsted was a real pioneer was in the way that he could tell these anecdotes in a way that made scientific sense. And so in one of the writings he left behind, he advocated for parks for their ecological value to the entire city, saying that air is disinfected by sunlight and foliage. Foliage also acts mechanically to purify the air by screening it. Opportunity and inducement to escape at frequent intervals from the confined and vitiated air of the commercial quarter, and to supply the lungs with air screened and purified by trees and recently acted upon by sunlight, together with opportunity and inducement to escape from conditions requiring vigilance, wariness, and activity toward other men. And so this goes towards sort of the strenuous mental activity that we were just talking about as well. But he echoed John Rausch's exhortation that parks should be available not just for the ecological services, but for their mental health benefits and available to all. And in the same writing, which is actually a speech to the American Social Science Association, he said, "A park should be a place to which people may go after their day's work is done, and where they may stroll for an hour, seeing, hearing, and feeling nothing of the bustle and jar of the streets, where they shall, in effect, find the city put far away from them." And so all of these ideas in his background were executed to various degrees in three of his best known parks, which I'll talk a little bit about now. That said, I think it's important to re-examine them in today's context and also think about how the execution of their designs maybe pushes back a little bit of our, the public's conceptions of them. We should always keep in mind that the natural beauty or rural beauty that we revere in Olmsted's designs were actually highly constructed, which allowed him to overlay all these ideas upon the closest thing we have to a blank slate landscape. Olmsted described the site that would become Central Park as squalid and swampy, and prior to becoming a park, he wrote that it was a mix of industries and squatters' shacks. The story that has gone less told until recently is that where Central Park stands now is actually the site of Seneca Village, which was a thriving African-American neighborhood who lost their fight in court to keep their homes from being razed. And it's a history that is only being reconciled today with an announcement made just last year that a monument will be built for the former residents there. The landscape of Prospect Park, similarly, was very rocky and completely remade in the sort of ideal pastoral image that Olmsted was advocating for. Even the trees in Prospect Park were placed by what at the time was a very innovative and forward-thinking machine. So John Y. Cuyler invented a machine for moving these trees in 1867, and here we can see them very carefully planting during the construction of Prospect Park. Now, of Central Park, Olmsted would advocate for its importance to urban ecology and for the mental health of urban denizens again, saying that two classes of improvements were to be planned for this purpose, one directed to secure pure and wholesome air to act through the lungs, the other to secure an antithesis of objects of vision to those of the streets and houses, which should act remedially by impressions on the mind and suggestions to the imagination. And we should always remember that even the presumably wildest parts of Central Park are highly designed to immerse you in wilderness and let you escape the city, literally encasing you in landscape. So to go back to Andrew's earlier questions, Olmsted's parks were deliberately light on recreational programs, but meant to be understood as works of art, passively uplifting society and a testament to the power of landscape in of itself. But at that time, that nature could only be appreciated by an elite class. Olmsted convinced the Central Park commissioners that his park needed constant surveillance under his own supervision, as people will, quote unquote, will need to be trained in the proper use of it and to be restrained in the abuse of it. In its early days, visitors to the park were not even allowed to walk on the grass or use rude language. In his writings justifying the value of a park, he decries the examples of pool rooms, grandstands, and stables that he saw installed in some European parks, calling them popular diversions of the class which we elsewhere look to Barnum to provide. But Olmsted and Vaux were always learning from previous projects. In Prospect Park, they actually wanted an extensive network of green spaces, as they felt sort of the self-contained nature of Central Park was not enough to bring health benefits to all. While that didn't happen, the space that Olmsted was allowed in Brooklyn did allow him his dream of pastoral vistas, a true escape from the city. And he even got his longed for sheep to maintain the grounds, really providing a rural picture in the middle of an urban area. When we look at Olmsted's paths, we can also see his idea of sort of passive health benefits of nature. Where they were placed were all about curation and control. Notice how the gentle curves in each park encourage leisurely walking, taking you through different scenes in the park and placing you adjacent to different landscape features. And the grounds were made for genteel activities such as tennis and croquet that could also easily be disappeared at the end of the day, so you would get your pastoral landscape back. Olmsted was vociferously against recreation that was much more active than this. The grounds were built for the working class to observe and learn from the upper class in proper leisure activities, and by placing them in the same space and presuming a universal predilection towards pastoral landscapes, Olmsted assumed that this alone would build civic solidarity and social equality. So whereas in his New York parks, Olmsted flexed his ideas of social justice and public health, in Boston, he really exemplified his knowledge of ecological infrastructure. The concept of public landscape as machine would really come into focus in his design for the Boston's Back Bay Fens. Between 1800 and 1855, Boston's population grew by more than 100,000 people. And as a result, the Back Bay, then a shallow saltwater bay, had become what was described as the Boston Globe and several other accounts as a public health menace, filled with sewage and other waste, as well as effluent from Stony Brook and Muddy River Creek. The area we now know as the Back Bay Fens is actually where salt hay would be harvested for the livestock that still lived in the city at the time. And as a collector of sewage and swamp water for several thousand acres in the growing city, Back Bay created a distinct health problem and olfactory nuisance for surrounding neighborhoods. When the tide fell, some sewage was carried out to sea, but a residue remained in the mud flats and was left to, quote unquote, bake odoriferously in the sun. Over time, the sewage sludge became incorporated into the mud and killed what remained of the estuary's original salt marsh ecology. And so eventually the Back Bay was dredged and filled. And the Back Bay was filled in as part of a massive land-making movement that not only covered up the water body, but provided ample new land for building houses closer to the city center. city commissioners were not only faced with a complex engineering problem, but the reputation of the Back Bay at this time was so negative, they had to make sure that this new neighborhood conveyed a sense of good health and social aspiration. And so Olmsted used the water bodies as an open sewage interceptor on the city side in case of heavy rain and overflow. He also made sure to plant trees that could withstand flooding and brackish waters in these events. And the rest of the park had separated paths for languid strolling or driving, such as his New York parks. However, Olmsted's designs for the fens were decidedly less picturesque and grand than Central Park's design of 20 years earlier, which raised some objections from nearby residents. An anonymous 1884 editorial in the Boston Globe after his park was built said that allowing for this passive retention of overflow would only, quote, have the effect of making the surface of the pond anything but pleasant to the eye, as there will be nothing picturesque in a green scum of filth, which will constantly accumulate and in the years to come, in all probability, will be the source of deadly miasma. He concluded that Olmsted said that the view from the railroad trains passing by at 40 miles an hour would be one of sylvan beauty, but I cannot see what there is beautiful about it at present after all the money has been spent. And so the Back Bay fence in Boston was decidedly, a much more experimental park. Although the damming of the Charles River effectively diminished the fence's purpose as the first constructed wetland in the United States, but there were other moments in the Emerald Necklace, and eventually the Back Bay fence that achieved these aesthetics of purified air that were so sought after in the early 1900s.
So I think it's interesting, right? Because we think of this today as like parks that provide ecosystem services or ecological services, but this was kind of frowned upon as seen as unnecessary at the time. I just find that so interesting how they called it essentially a cesspool.
Yeah, no, even after it was built, and that's why it was very experimental. And I was, when I was putting the slides together, I was also just looking at these pictures, and I always kind of described the Back Bay Fest to my students as Olmsted's punk rock park, right? Because it was like, it's experimental and it was a little bit wild, but what happened in the end was like he built it and nobody liked it, even though it functioned very well for what it was supposed to do, which is it was an open waterway. But also just keep in mind at this time, people were very suspicious of any standing water at all, having just come out of the cholera epidemic. And so, even though it had been for most part wiped out of the city, this idea that disease was airborne, which is a familiar phrase we're dealing with today, was people were still very worried about it.
Yeah, great. I was just so struck by that headline, because I think the parks that were built before, I mean, we do think about them today as providing some of these services, whether it's, absorbing stormwater and help mitigating stormwater overflow and things like that. But it seems that wasn't necessarily at the front of mind in the earlier part of his career. Is that right?
Yeah, well, I think, what happened here is that Olmsted was always growing and he was always trying to experiment. And what was happening here is like, I think, to be able to keep in mind, and this even goes to today, is ecology is not always pretty, right? And that especially goes for wetlands. And so it can be very functional, but it may not fit our aesthetic idea of what nature is, right? And even considering like how controlled the nature is in Prospect Park and Central Park, people do think it's a natural landscape. And so on the Back Bay fens, which he allowed to be a little bit wilder and maybe more functional, people really push back about that. Or maybe it goes into, the long-standing rivalry between Boston and New York, where Boston.
Right.
Yeah. So.
Karen in the chat just shared a link about a 1871 report that Olmsted wrote about Staten Island, making suggestions regarding draining, quote, malarial swamps. But she adds that these suggestions were largely ignored.
Yeah, and again, this is just keep in mind there was still a lot of fear from the recent cholera epidemics, right? And at this time, a lot of people still were not certain about how the disease worked and how the disease spread. And so because it was so closely associated with, what they would call bad airs and waters, even though it was a bacteria, right? People were just very suspicious of any kind of standing water.
Yeah, great, thanks.
Yeah. Thanks for the question, and thanks for the link, Karen. And so, as I mentioned, the Back Bay Fens and quite ping people's desire for this aesthetic for purified air. And so as a result, there were many improvements made to the Back Bay Fens over the years without Olmsted's approval. And a lot of parts of the Emerald Necklace now likely would have rankled Olmsted's desire for a naturalistic park, but it did fit the public's conception of what a genteel urban park should look like. And so over time, just in the Back Bay Fens, we've seen a rose garden, which was added in 1931 by Arthur Shercliffe, and also those hated recreational fields that Olmsted was so against. However, I mean, as cantankerous as Olmsted maybe comes across in his writing, I think he understood that parks would change in response to their context and constant flux of ecology. And as I talked about with Andrew, many of Olmsted's ideas have now been empirically proven for the way that they provide ecosystem services in the city, for how they provide mental health benefits and physical health benefits. Of course, now our urban landscape is facing unprecedented challenges. The first being climate change. The prevalence of urban floods today is probably not even one he could have predicted. And of course now, pandemic. So this is a picture that was taken in the Emerald Necklace just a couple months ago. I think for all of Olmsted's careful planning of separated paths, he probably couldn't foresee that people would have to traverse them constantly 6 feet apart. And for all his discussion of parks and health and parks as breathing spaces, he probably couldn't foresee his designs being used as literal hospitals for a pandemic of respiratory disease. And while the parks themselves have proved timeless, we cannot apply all of his ideas with a broad brush. While Olmsted was an outspoken abolitionist, many of his parks came at the cost of clearing out Black and immigrant neighborhoods. He believed in the free accessibility of public spaces, but at the same time openly promised municipal leaders and businessmen that they would raise property values and effectively move out the poor neighborhoods. He advocated for places where all economic classes could mix, but for the purpose of the upper class to essentially refine the working class. And keep in mind that he was also vociferously against any kind of political speech in his parks. So I think what we see now with all the pressures on our urban infrastructure, that it's not enough to just passively bring people together. That alone does not promise equality, and in fact can often cleave wider inequality. Even though he probably would have frowned upon it, the kind of free speech that is being made in his parks today, the fact remains that his parks are there and they do allow for it. And so they are still a great social and ecological infrastructure for our cities, but we might want to think about how these contradictions may exclude those most vulnerable to the effects of climate change, of pandemics, and economic inequality. In effect, the people whose health we should prioritize in the coming decades. So, as Andrew mentioned, I teach at Northeastern University, which is actually at the edge of the Back Bay Fens. And so, one of my studio projects I asked my students to do is to reimagine Olmsted's goals for their future. And they come up with parks that are dealing with a lot more pressure on how they deal with water and stormwater. They imagine places for places of social meeting. They imagine places of active recreation. And this is one of my favorite exercises to do with my students over the past couple of years, because I know that they, in effect, are going to be shaping our future landscape. And I love to see how they take Olmsted's lessons, but also fit them for a much more volatile century that they, in turn, will be stewards of. And so with that, I'm going to end on this hopeful note and showing some of my students' work. And I thank you all for listening today. I look forward to your questions, but if we don't get to them, I just wanted to end. And this is my email up on the screen if you have any further questions after the presentation today. Thank you.
Great, thank you so much, Sarah. Yeah, so we have a few questions from the audience, and feel free to continue to drop them into the chat. I do want to touch more on this topic of how the parks have really adapted despite what were some of Olmsted's views about how they should be used. But Jay had a really interesting question that I had never really thought of before. So we've talked about landscapes and plants and how they play a role in the vision and purpose of the park. What role did animals and wildlife play in the sort of vision and planning of the park? Like, were there animals that were seen that needed to be removed, or ones that needed to be added, things like that?
Yeah, that's a question. I don't think I thought. I mean, a lot of livestock was moved out of these areas to clean the park. I think we have to keep in mind that even the progressive era, animals and wildlife were really seen as sort of a in service of the people that live there, right? And so what we imagine is this. What Olmsted imagined was this very idealized landscape where you would have domesticated sheep, right, trimming the grass in the park. And so I don't know if he was thinking very specifically about what we would, talk about as wildlife corridors today, and sort of the One Health concept of both animals and people. So I don't think it was forefront. I think his ideas about animals in the park kind of fit this purified air vision, where he didn't want polluting cows and horses that were in a lot of these landscapes before he built them, but just sort of, again, this very picturesque idea of sheep, maybe dogs in the park. But that's not to say that it doesn't provide those ecosystem services in the case of wildlife today. And we can see it now if you walk through these parks, and if you're bird watching, right, or chipmunks and squirrels and rats, all part of our wonderful urban ecosystem.
Yeah. We had another question from Alexandra, who says, did shifting understandings of germ theory and antibiotics change attitudes towards the health value of parks over time?
Yes, absolutely. And and so I actually have a book coming out next year that's about how different landscapes have responded to different epidemics over time. And of course, now it's getting a quick rewrite at the end due to the recent pandemic. But that's actually a major split in the book, in that up until germ theory and vaccines, we really looked very closely at the connection between built environment and health. And then after germ theory and vaccines, then we thought of health that could be applied on an individual level, right? So that was just sort of like medicine for treatment. And so I think that also speaks to why we are kind of turning back to these progressive era parks and city planning in order to think about how to deal with the pandemic today, because it's been a long time since we've had to deal with an infectious disease in the developed world. But this is also the last time that we saw urban planners and landscape architects and public health officials, and as you saw, even doctors, that were interested in this kind of mission of shaping the built environment for health outcomes, and really interested in studying it together and coming together. And there was a lot more, I would say, municipal cooperation at the time between these departments and designers that were interested in it as well.
Great. Yeah, so many people in the chat have been sharing, how they've been enjoying the parks during this time or during regular time, and how important it is for mental and physical health. Someone just asked, Judy has a really good question, which is, can you speak briefly about the importance of park maintenance and how poorly maintained parks can be detrimental to communities?
Absolutely, and I think that's one of my colleagues, Judy Robinson. So hi Judy, if that's you that asked the question.
Yeah, it is.
Yeah. So Judy's a planner in Sacramento County who I've actually worked with, who's done an incredible amount. She actually kind of helped me on my journey towards studying built environment and health. But Andrew, as you and I know, as you and Doug and I were all talking just before the talk, is that maintenance is definitely not discussed enough in terms of how a public park remains a public health benefit. And we're in an extremely tragic time right now where, the budgets for both are being cut. Maintenance is very important because maintenance not only keeps the ecosystem services of a park running, but we also have to, you have to give that appearance of maintenance for people to use it, right? So people are not going to use the park if it's unmaintained. It can be detrimental to their mental health if they see a park in their neighborhood that is neglected, right? Because it may make them think that as a population themselves, they're neglected. And so maintenance is a key part of it. I think and I think that's actually what we see in the example of the Back Bay Fens is Olmsted kind of looked at this as a naturalistic landscape that could be a machine in of itself, that would just operate it. But the look of it, the fact that it was wild and not maintained, made people think that it was actually not beneficial for their health. And so, yes, definitely not talked about enough, but a crucial piece of maintaining parks as public health infrastructure.
For sure, yeah, and something that we're having to confront now because the pandemic has its own financial dimensions and huge impacts on public budgets, and unfortunately, their parks are often the first thing to get cut when we're facing something like that.
Right.
Ruth just asked, is there a public-private sharing of park maintenance by NYC Parks Department? I can answer that. The answer is yes. But maybe it's something something that you can comment on. What's been the impact over the last 40, 50 years, I would say, with the growth of these public-private partnerships and conservancies, not just in New York, but in other parts of the country to help maintain parks?
Yeah, so I think that's, so I do some talks and some work with the Emerald Necklace Conservancy, which is up here in Boston, and they do a lot around the maintenance, whether it's, corralling volunteer efforts around cleaning up the Muddy River in the Emerald Necklace. I think these kind of programs are very important because they also help build what we call stewardship of the park. And then if you're interested in the health benefits, there's also there's a lot of empirical research out there that talks about, actually getting out there in the dirt and planting things might be beneficial for your health as well as building social cohesion, right? Because you meet other people that are interested in maintaining the park. But of course, I don't think it's enough. I do think just, and I don't know where the next steps are, but just as a nation, we have to prioritize both our public parks and public health. But maybe the power is in seeing where those two budgets overlap and seeing them as a common goal and outcome.
Yeah, and Diane just asked, is that something that is actually happening? Is there any real input public to decisions made about parks or budgetary decisions?
I can't speak to it. I'm not sure. I know in New York City, right, there was a manual that came out a while ago that was a collaboration between the Department of Urban Design and the Department of Mental Health, and they actually did a great template that I refer to all the time. That's a manual on active design and physical activity in the city. So while it wasn't, I don't think a budgetary collaboration, that was the sort of unification between different departments that used to be quite common in Olmsted's time, that has not been for a long time. And so I do think in cities like New York and San Francisco, we're starting to see more of those collaborations between departments. Something I've been interested in lately and was looking at pre-pandemic was maybe what is the role of hospitals in terms of funding public parks, because since Obamacare, every hospital is required to do what's called a community needs assessment, and physical environment is a part of that. And so there were some promising sort of small initiatives where parks were actually involved, hospitals were involved in park maintenance because they were starting to look at them as a public health initiative. And this is, of course, when you're dealing with, chronic disease is a real issue then, and how do you fund preventative health outside, basically health beyond healthcare, right, outside the healthcare facility, and how that can help. And so there were promising moves towards that, I think, before the pandemic. But of course, everybody's resources are very stretched right now, but I hope that's something we come back to.
Yeah, and we actually had the opportunity to work with some people that work in horticultural therapy. I know specifically more with the Botanic Gardens, Brooklyn Botanic Garden and New York Botanical Garden,
Right.
that work with different service providers as well as some healthcare providers, and just seeing the value of putting your hands in the dirt and being in these spaces to helping people with all sorts of different medical concerns. So that's really interesting. How I think one comment that's come through a lot that people have made is how they see so many of these things siloed, and it's so great to hear through the story of Olmsted, 150 years ago that he was bringing these things together, and now it's sort of starting to happen again.
Yeah, and I'd say, that, thinking about how health is serviced outside the hospital actually reflects sort of my own personal journeys. I was a healthcare architect for a long time, so I was designing healthcare spaces, and I actually got interested in the story of Olmsted while I was working for a firm that did mostly hospital work, and it kind of sent me on this journey to think about, okay, how can these sort of this research that we were using in healthcare facilities, how could that be applied on an urban design level? And ultimately that was pretty naive, but I do think there's a real power in that, and thinking about how do we design everything between our buildings and outside our buildings to create a healthy and more equitable environment.
Great. Well, Sarah, we want to thank you so much. If you could just pull down your screen for a moment.
Sure.
Thank you so much for taking the time to join us today, and thank you to everyone for asking such great questions. This was such an engaging and interesting conversation. I know I learned so much. I'm sure Doug and Cindy did as well. Anything you want to add before we say goodbye?
No, I'm just sorry. I'm finally pulling up the chat window and seeing everybody. It's really great seeing everybody sharing those experiences. I wish I was doing this talk in Prospect Park, which is one of my very favorite Olmsted designs. And I see some questions about it. That yes, it was sort of. I love it because it was sort of the purest manifestation of Olmsted's ideas for all the contradictions that it brings, but looking forward to when we can all be out there again.
Yeah, great. Well, Sarah, thank you so much. Stay safe, and we're really looking forward to your book coming out next year, right?
Yeah, pending some major rewrites.
Right.
Early next year.
Yeah, great. Yeah. Well, thank you so much, Sarah. And thank you so much to our partners at the Prospect Park Alliance and to everyone who joined us. Just as a last parting note, I just wanted to mention, if you want to continue to support this programming, you can become a member of Turnstile Tours. You can visit our website at turnstiletours.com, and we have a number of great programs coming up. So you can join us on Thursday. We're going to be talking about Shipbuilding aboard the USS Bonhomme Richard, as well as connections to New York Harbor and the Brooklyn Navy Yard. Next week, we're going to be talking about the Marx Brothers and their history in New York City. And we're also going to have our first member happy hour. So I know we have a lot of members who are signed on right now, so we'll see you next Thursday. And if you want to join us for a great conversation, you can visit our website at turnstiletours.com. So, Sarah, thank you so much. Thank you so much to the Prospect Park Alliance. And we'll see you on Thursday.
Okay, bye.